All right, everyone, welcome back to our pregnancy series. My name is Angie Maxwell. I'm a doctor of physical therapy, owner of Madrona Physical Therapy. And I have my friend Kaylee here, and we're going to go through the sleeping positions that might be helpful to you. So let's start out with, I think, laying on your side. So do your nice log roll down to your side, bring the legs up. Yep. And one thing you want to think about with sleeping is we want to keep this spine in what we call neutral. So you can kind of see right here that Kaylee's got a little bit of a valley. And so this part of her spine is bending a little bit more, and this part up here as well. So just to ease those ligaments, ease her low back pain, we want to put a pillow right kind of in the underneath that valley. That's going to put her spine in nice alignment. The other thing it does is it will help her rest her belly and take off some of the weight of the belly that's trying to rotate that spine forward. So a lot of this will help ease that low back pain. So we've got our pile of pillows here. And we're going to start out with having her go ahead and sit back up for me. And we're going to lay this kind of perpendicular and put it right in that nice valley of her spine there. All right. So you can see she's got a little bit on this side, a little bit on this side. That's going to help keep the belly a little more supported as well. The other thing to think about is we've got her hip and her knees at a little bit of an angle. And I don't want that either, because the weight of your leg when you sleep can actually kind of rotate your pelvis forward. So if we go ahead and put a pillow here and just kind of keep that knee in line with the hip, that's going to ease her back and pelvis as well. So let's go ahead and put a pillow, I'm going to put a long one, so it goes between her knees and her ankles, and she can keep that nice kind of straight alignment between her knee and her hip. And then she's got a good alignment here and supported belly, and her pelvis is floating a little bit between these two pillows, so that can really feel good as well. So one precaution during pregnancy that I'm sure your midwife or OBGYN talked with you about is this idea of after about 28 weeks, you don't want to be laying on your back. That is because the weight of the uterus can actually compress and cause blood flow issues between your inferior vena cava and your aorta. It can cause you to pass out, have preterm labor, some really bad things. So you want to avoid any sort of positions where you're laying on your back for very long. The other thing I like about this position is it kind of blocks you from rolling on your back because you've got this pillow here. The other thing you can do is have your partner go ahead and take a pillow and wedge it in there a little bit more. So again, you're not doing that kind of flopping onto your back in your sleep. So I'm going to bring this pillow, just give a little bit of extra cushion, and create a little bit of a wedge. Now, having said that, we don't want you laying on your back. There is a position that we call semisupine, which is kind of like halfway between being on your side and being on your back. So if you are a diehard back sleeper and it's really hard for you not to sleep on your back, you can try this semisupine. So you want to make sure that you're sort of, like I said, in between the side and the back. So if you roll that way just a little bit, Kaylee. Yep, and then straighten this leg. And then roll a little bit more into that pillow. So she's in a sort of a sideline, but also on her back position, sort of right in between. Now we may want to bring another pillow in, put that here, so she can stretch that leg out and not be twisting through her pelvis. She's still got that nice line here, and she's still got her low back supported, and the pillow here to support the belly, which we can tuck in a little bit more. And how's that feel to you, Kaylee?
Feels good. I can fall asleep.
So, you start to become the pillow hog at your house, but it's definitely worth it to have some different positions you can try. There are lots of pregnancy pillows out there, and we will put some links on our website to give you kind of our top 3. Some of the pillows I think are better in terms of their shape, and others are better in terms of how much cushion they have. So we'll give you some tips on that as well. So thanks for tuning in, and I hope that you'll check out our next episode where we are going to talk about how you should move in the kitchen. Thank you.